Welcome to the ANEW Body Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogrammed Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. And Chantal Donnelly, physical therapist and author of Settled, How to Find Calm in a Stress-Inducing World. Here at City Club Los Angeles, we follow our guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Body Insight podcast. We are back for the second half of our episode with OBGYN to the stars, Dr. Gail Jackson at City Club Los Angeles. Dr. Gail gave us some background about her inspiration to become this leader and innovator in obstetrics and gynecology. We are so ready to learn more. Dr. Gail, welcome back.
Thank you so much.
Yay. So I want you to give me a picture of what it's like for a client to come in. Just paint a picture what it's like when they leave your office and how their life changes after that.
Okay, I'll start with a 45-year-older. Because let's say a 45-year-old comes in, I call her Janet. I could actually call her in my book Janet. So I delivered her babies, and her babies are going to college, and she has this amazing husband who she loves dearly, and she says, I don't get it. I just don't feel it. I love him, but I just don't feel like sex. I don't want to have sex. I know I should have sex, and I don't understand why I just don't feel it. Like one of those old songs you wouldn't know. Oh, you've lost that loving feeling. But
I know that song.
You know that song?
I know that song.
Okay, so, you want to sing it for me? Okay, now.
You've lost
there you go.
that loving feeling.
Dear sing. Okay, so anyhow, she came into me and she says, I need some help because this is what's going on. And so so when I talked to her further, some of her other symptoms were inability to sleep, memory, little light forgetfulness, edgy. She said, I feel like I'm snapping at everybody.
Yeah.
You know, mood swings. Sometimes I'm high, sometimes I'm low, and I just don't know. I try to get rest. I try to, self-care. I try to take care of myself, and I can't understand why I'm not feeling like I used to feel. And I knew how she used to feel. So we did her hormone levels, and specifically her testosterone level was low.
Okay.
Our balancing goal is like 150 to 200, and hers was maybe 5 to 10. I think women have a huge aha moment when they realize it's not in their head.
Yes.
Because it's like, I don't want to take Valium. I don't want to take this. And I know I'm not crazy. And so we have her come in, we talk to her, we share her symptoms, talk about her symptoms, we quantify her symptoms, we share her labs. And then we offer her the pellets. We use hormone balancing specifically in the form of pellets in our office for 3 reasons. First of all, they're the size and softness of a kernel of cooked rice.
Ooh.
So we place them painlessly underneath your skin in the hip area in the back, like your upper thong line where your bathing suit band, your panty band goes, okay?
Okay.
And they slowly release over 4 months with results a day and a half to a week. We exclusively use those for 3 reasons. Number one, it's all about our patients. It's all about you. You come in every 4 months, you're good to go.
Oh, wow.
So no daily dosing, no rubbing on creams, no swallowing, no troches, etc. Because plant-based hormones are given in many forms.
Yeah.
We tried them all. We just find that we get the best results, best predictable results with the pellets. Number 2 reason is the efficacy. We can give you less of amount of hormone to get maximum results because we put it underneath your skin, goes directly to your target organ. And instead of the circuitous route. Okay,
Yes.
the circuitous route. Okay, we circumvent the circuitous route. Okay, so
Say that 5 times
when
fast.
when hormones and medicines are taken by mouth, they have to be coated so the stomach acids don't destroy them. Also, when they are presented to the liver, number 1 can change it to a form that's not as safe.
Yeah.
And number 2, it can cause other processes in the body that are not good. For instance, developing blood clots in the legs, which could go to lung cancer. I mean, not lung blood clots to the lung, sorry.
Uh-huh.
Blood clots to the lung. So those are the 3 reasons why we use pellets, and our pellets are provided to us in individual sterile containers by a compounding pharmacy.
Mhm.
So they're made from they're yam-based, but it's not somebody digging yam and bringing us a bowl in the office, okay?
And you're
So
spreading yam all over yourself.
yeah. So, they're provided to us. So I have estrogen in maybe 5 different dosages, testosterone also in 5 different dosages. So this young lady, Janet, her symptoms are at this time is specifically low testosterone. So we
Mhm.
balance her testosterone,
Yeah.
which means we give her a pellet,
Mhm.
and then we get her labs in 1 month to see if we achieved our results.
Wow.
And also we have a phone call. How are you feeling?
Mhm.
And with her, amazing.
Yay.
So then one big problem, and she's amazing. Can hubby keep up with her?
Well, that is a
So
whole other can of worms, right?
yes, yes.
Mhm.
So we have, and women then ask, "Do you have anything for my husband?" And yes, 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 we do. So we
Ah.
balance men, typically the partners of our ladies, but we do balance men with testosterone only. Men do not need estrogen or want
Agreed.
estrogen. It called man breasts when they have extra estrogen.
Is it the same kind of thing where they might go into their doctor and they're told that their level is fine, but you're thinking not so much?
Yes, but they are usually told they're low. They
Mhm.
usually get a little because they often go to a male doctor who gets it,
Mhm.
and a man's testosterone maximally should be about 800 to 1,000. So if he goes in there and he's like 50, and that's prime age. If you go in there and you're 55 or so, and your testosterone is 300, I think most practitioners say, "Hey, you're running on third of a tank. Let
Mm.
me help you with a testosterone injection. You get it every 2 weeks. However, it's synthetic."
Aha. So
So
is that true? Most testosterone that you get from your MD is synthetic.
all testosterone you give from the injection, it comes in a vial and is synthetic, and it has a black box warning because you may have heard increase the risk of heart attacks and
Ah.
strokes
What
because
about pill form? Same thing?
I don't know if testosterone in pill form. I don't It's not absorbable as far as I know.
Oh,
Not testosterone.
okay.
So because I don't take care of that many men, so we focus on just the pellets. I've never
Mhm.
heard of it of testosterone in a pill form.
Yeah.
Yeah. So, they have Viagra and Cialis, of course, but they're not testosterone. They work
Right,
in a
right, right.
different way. So, yeah. So the reason it's a black box is because it increases your hemoglobin and hematocrit, which you're clotting. It makes your blood run like thick, like ketchup.
Ugh.
So guys you have to get their blood checked regularly, and they often donate a unit of blood to get their blood thinned out.
Yes.
So this does not occur with the pellets. Yeah.
Aha. And what
So,
do you see with men who are taking
well,
pellets? Is it just all sorts of action?
I
Is
got this balancing somebody. So you want rings and things, and you like
Yay!
jewelry and purses and things like that. You're like you balance guys. So basically, it brings their life to back. You can they have they have intercourse. Most of them feel amazing. They love it. They come regularly, and we do add
Literally,
Cialis.
they come regularly.
Yeah, and yes, literally and figuratively. So and we add Cialis to just give them that extra gusto they desire. So we have some pretty happy 60-plus-year-old guys walking around. Yeah,
Wow,
who are
that's
doing better than they were doing in their 30s,
I love
40s.
it. Does it
Yeah.
help for anything other than, the act?
Yes, and this is how we ask women, suggest them to introduce it to the husband instead of like, look, your erections are weak, you need to go in. Like, baby, you think you're so tired all the time. You can use this for Dr. Gail has something for your energy, for your focus. You go to the gym, you work out, you're not getting results. So that's always a good one because guys really they complain. I go to the gym, I'm working out, I'm not getting results. I'm tired. And then often I've had a few men come to me and say, I have this amazing wife. I love her. I look at her, I love her, but I just don't have the desire.
Yes.
So we have a few men who've come to us by themselves wanting to be better partners with their wives.
Right. And does low testosterone, is that I've heard it comes from a bunch of different places, or the lack, not low testosterone, but the lack of desire comes from a few different places in men. It can be because of their, health status, difficulties with their heart, blood flow, like low nitric oxide, I believe it is.
Mhm.
It could be psychological. What are you seeing as far as why men might lose their
We
libido?
basically tell them, we get it. We get you where your balancing goal is. We've got your Cialis. So if it's not working, we've done what we can do. So
Ah,
then there are other things because, like you said, that some men are so overweight, it's just not comfortable or wherever. But usually, if they seek us, they're seeking to be a better. They're seeking to be healthier.
I
So they're
see.
ready to incorporate their lives into being healthier men.
Okay. So, helping men to be healthier and helping ladies lift it up a little bit. We're
Yes.
lifting, we're tightening. Tell us about the Lady Lift. This is an innovative offering in your practice, and it utilizes platelet rich plasma. So, tell me all about that. How does that work? What are the outcomes?
Okay. Well,
Lighter,
first
tighter.
of all, my little quip is if you got a kid or two and a boo, you're peeing. And so women wear pee pads. They're not incontinent because incontinence is grandma in the nursing home that wears a diaper. You
Right.
walk into the room, you smell the urine. Okay, that's
Mhm.
not what we do. So we are not incontinent. We peas when we sneeze and we piddle when we giggle. And we have the who's in the bathroom? Hurry up, gotta go. So, with those concerns, and there are women who have not had babies, but they are still have those symptoms. So, if you're with a group of women and you talk about it and just talk about the lady lip and how much you enjoy it, and they're like, "Oh, I don't have any problems with that," you go, "We know what you're not doing." Okay, because if you're having sex, you have a kid or two, you're peeing. Okay,
Yeah.
and so just so women come to us first of all to usually the gotta goes brings us to because they like, I just can't. I so tired of not being able to control my bladder. So
Hmm.
platelet-rich plasma is familiar to many women because they get the microneedling on the face,
Mm,
and men definitely know about it because they have the injections in their knee. All athletes, most athletes have had platelet-rich plasma.
interesting.
What is it? You draw your blood, get rid of the red cells.
Mm.
So what's left is this liquid gold. We call it that's platelet-rich plasma. And once it's activated, it can be injected in in any part of the body or inserted in any part of the body, and it regenerates that cell. This is
Whoa.
how the body heals itself. For example, we'll say little boys because girls don't fall as much. Little boys always fall, and they scrape themselves and develop a scab.
Hmm.
We always tell them don't pick the scab off. Why?
I always pick scabs. I'm
Okay,
terrible about it.
because when you pick the scab off, underneath it is that yellow goop. That's platelet-rich plasma. So
Yeah.
that's how the body heals itself. So we
Yeah.
steal that property and use it anywhere we want in the body. Many people know when Kobe shredded his Achilles.
Yeah.
I have colleagues who are orthopedic surgeons. It was too shredded for surgery.
Hmm.
He had PRP, and
Wow.
he went on to score that 60-point game.
Oh my goodness.
So it works very well. I recently had it in my knee, and I'm praying it really worked in my other knee,
Yay.
but it really helps a lot. So same platelet-rich plasma. Let's get back to us. What's
Yes.
really important? We're important.
Right. I mean,
Yeah,
who cares about these guys? Come on.
right. So I place it underneath the urethra, which is the opening of the bladder,
Hmm.
and I use a good numbing gel, little injectable anesthesia, and it improves. So, and I put it there, and that's where the support of the bladder is. We call it the bladder neck, and it improves bladder support by 80%. By the
Wow.
way, if we gave it a cute little name, Lady Lift. If you want to Google it, it's known as the O shot.
Oh,
The
shot.
O shot. The O shot is made by forgot his name. This guy named patent that name, but he's focused more on the clitoris and orgasms.
Ah.
Usually, our women are balanced with testosterone, so they don't need the extra. And the
Yeah.
thought about injecting it in the clitoris is like, oh,
Howie, I don't
yeah,
even want to think about it. It's like,
right. So
no.
we put it underneath the urethra, which is in the opening of the bladder. But guess what else is there? Your G spot.
Yes.
Yes, so
So
you get
action
G
is
spot enhanced.
happening.
You get G spot enhancement with the lady lip. And since we have a little extra product, we pucker up those lips. They need a spa day too.
Yes.
As we
Especially after childbirth.
right, we got
Yeah.
and in the years you've asked so much of her, right? She needs a spa day.
That's right.
As we get older, the lips of the vagina deflate and droop. So we pucker up those lips.
Wow. What about natural ways to do that? Do you have any like Kegel recommendations or anything like that for?
Well,
a natural lift?
we offer a wonderful little um toy called the Kegel. And
Yes.
so it helps you do the Kegel. You don't have to think about it. You put it in the vagina,
Hmm.
and it's like a game. You Bluetooth it to your phone, and you play the game, and you have to squeeze the ball to hit the target. So we have a little printout of how to do Kegels, but it's much easier to squeeze the ball into the target. So that's something we offer, and we give it as a gift when you get the with the lady lift.
That is so
Because you have
great.
new cells, you need to exercise those new cells.
Yes.
Yeah.
How long? I mean, does the lady lift last forever? Or do you have to get a little,
Well, I had it twice. Everything I've needed, and I'm transparent. I'm authentic. I've needed it, and I had it within like 3 months, and that was 6 years ago. And I can just sit forever and like, oh, maybe I should go, or but it was pretty rough. So anyhow,
Mm.
because I have those other qualities, anyhow, other things going on. So anyhow, um, where was I? So the other thing the lady lift is really great for is there are women who either cannot or choose to not take estrogen.
Yes.
And they're
Tell
just,
us about them.
yeah, because they're women who've experienced breast cancer, estrogen dependent.
Hmm.
And there are a lot of articles recently, which I'm so happy about, that talk about the long-term sequelae of the cancer survivor. And that's one of the things we're talking about, that Tiffany does too. Because it's like,
Mm.
okay, yay, I'm cancer free, but look at my body, And
Mm.
so many of them with estrogen positive receptors can never or recommended to never take estrogen.
I
So what do
see.
they do?
Yes. What do they do?
Because the vagina shrivels up like an old lady, or can,
Wow.
unless the lady lift really helps with that. So we
Oh,
have that, and then vitamin E oil to help. So you have to start nourishing it before the changes begin to occur. But the ladies who come and can't take estrogen, but they want help with those symptoms, the lady lift is so perfect, and there's no
yes.
hormones associated.
What about for women in their like 30s, 40s, before they're hitting, perimenopause? Is there anything that they can do? Should they just be doing Kegels right and left? I mean, I'm a Pilates instructor, so that there's Kegels naturally in a lot of Pilates moves. Is there anything that you recommend for younger women that might be more preventative later on?
Don't you hate them? They don't have those symptoms. So we don't focus on it until the symptoms occur,
I
because
know.
everyone doesn't have it. So there's
Right.
no need to get the treatment, because they naturally have pelvic support. Pelvic
Right.
support lack of pelvic support comes with aging. Then you asked me about the frequency. If a
Yes.
woman is significantly symptomatic, in other words, she's like, usually it takes two treatments. So we do it once, and it takes 3 months to experience
Mm.
the maximum results from that treatment. Then after that, you can maybe get a second, and most of our ladies at most get two, and then they go a couple years. We have a lot of them that come in once a year just to kind of tweak it up, because they love it's like Juvederm,
Yeah, yeah, yeah.
Juvederm or whatever, but they love the
It's plumping
pucker.
it up.
Yes,
Yes.
they love the plump.
Well, on this same note, you promote sexual wellness, of course.
Mhm.
What do you see as the key components to maintaining sexual health and wellness through the woman's life? 30s, 40s, 50s, beyond.
Well, if a woman's worth 40s, 50s, and beyond, first of all, it's definitely a different woman. As women age in their 60s, many of them may not have a partner from divorce or death.
Hmm.
So it's important though to keep the vagina healthy.
Yes.
And my colleague Tiffany works with me, and she has lots of uh, toys that
Yes.
really do great jobs with stimulating the vagina and keeping it healthy and alive, because these toys really stimulate the blood flow.
Yes.
So if whether or not intercourse will do the same. So if you're at the point where you either are not having intercourse, or you have a partner that's not able to have intercourse from whatever reasons, then it's important to have these toys to help the vagina stay healthy for also the rest of your life, because they help with pelvic support and incontinence and those things as you get older. You want to be really cute and healthy and sassy in the nursing home.
Oh, yes, you
You
do.
want to be
And
that
just a
girl.
fun fact, Tiffany, who works with Tiffany Yelverton, who works with Dr. Gail, is going to be our next City Club
Ooh.
podcast. Yes, so we're going to be talking all about toys and the fun little things that you can do in the bedroom. So it's just about keeping. Things tight.
Keeping the blood flow going.
Yes.
Yeah, keeping the
Yes.
blood flow. And she'll talk to you more about oxytocin and just
Mhm.
the relief. Sexual relief of sexual tension helps you sleep.
Yes, it does.
So, yeah, sounds like
Mhm.
she's co-signing that pretty loud over there.
Oh, what do
Anyhow,
I know? I have
somebody I know
no
is going,
idea.
yes, okay. I can see him, they can't. Anyhow, so
He definitely
yes,
helps in that
so
region,
it's
yes.
important
Mhm.
it's
I love
throughout your
it.
life to just maintain good vaginal health.
Okay.
Yeah.
I love this. So now let's talk about anti-aging.
Okay.
Tell us some of the latest, safest, most effective therapies for anti-aging and wellness.
So we focus on the things we've talked about. Okay,
Mhm.
so if there are things out of my realm, then I have colleagues that we refer to. So maybe
Mhm.
I have those, and a lot of those colleagues publish chapters in my book.
Yes, we are going to
Shameless
talk. Why don't we just talk
promotion.
about this now? I
Yay.
was saving that question, but we've got the book. Tell us about this book and tell us about the anti-aging aspects
Yes.
within
Well,
the
I,
book.
I think you shouldn't be afraid of it. I have some ladies like, oh, I would never get this. I would never get this. To me, I want to know what's available
Mhm.
and how I can look my best.
Mhm.
And then I am anxious to get it,
Yes.
and I'll be the one to try. Yeah. So we have various colleagues here who've shared their expertise in the book. Dr. Blanca Orliff she's amazing. Amazing professional with the face, and she does the injections because
Mhm.
Botox, the person who gives you Botox has to be such an expert in that because
Mm.
some people get the brow hair and whatever, and it's very
Yeah.
delicate, especially in the brow, because
Mhm.
you don't want it to be too relaxed that your brow drops. You
Yes.
want to get the lift, and then Juvederm, and you want the latest, and then their proper peels, etc. And
Mhm.
Dr. Abby, who's in our book, who comes to our office a couple few times a month, helps women with PRP injections in their scalp because
Oh.
as women age, sometimes they lose. Her hair gets thin here, and she injects
Yes.
there.
Talk about that.
Yeah,
That's something I think that's quite common that
right,
is not talked about very
exactly.
much. Tell us about that.
Yeah, so as women age, their hairlines tend to recede, and
Mhm.
sometimes, especially if you're certain ethnicity using braiding, or whatever, and it's heavy. Braids are heavy on
Mhm.
your hair,
Yeah, and
and
the
then women,
products too, I'm sure, right?
yeah, and then
Mhm.
women get well, most of the braids because it's pulling.
Uh-huh.
Yeah, we don't use products if you do braids.
Mhm.
Okay, so but women of all ages complain about thinning hair.
Mhm.
So Dr. Abby has a formulation called Grow, which
Mm.
combines pharmaceutical levels of two or three wonderful components that really work. And so you can just rub it into your scalp, and women have great results. So I think we can
Wow.
purchase that off our website too.
Wow. Well,
And
go into a little bit more about your book. Let's talk
okay.
about it. Pump it up. Let's hear about
Okay,
it.
so my book is absolutely fabulous, and it really talks about all the kind of things we discussed here to
Mhm.
just kind of give you an idea. And we have some different patients that we've kind of taken through different modalities and talked about what they need and how they benefited. And
Mhm.
then we destroy all those myths about synthetic versus plant-based hormone balancing,
Great.
etc. And yeah, so and it's been a lot of fun. Well, I'll give a shameless promotion.
Do it.
So we were ready to go. I love you. We were ready to go, ready to close, and then we decided. Well, someone decided to me, like, you know what? You have a few A-list clients. How about if they add a testimonial? So
Yes.
I thought, because often people are shy, they don't want to know this and whatever, and so we sent out a little request, and they overwhelmingly gave me some
Yay.
testimonials. Shall I quote a few names
Please?
since they're in the back of the book?
Yes.
So we then changed the back of the book for their with including their testimonials. Well, first and foremost, we have Angela Bassett.
Ah.
And then we have Shawnee Henderson, who is
Oh,
Shaq's who's a media mogul and Basketball Wives.
wow.
Vivica Fox, the actress.
Yay.
Tony Braxton, the singer.
Yay.
And then we open up and we have a few. We had so many, we had to make an inside
Love it.
cover. And Wendy Raquel Robinson, Candy
Hey.
Isley, who's married to Ronald Isley of the Isley brother, Angela Gibbs, who's an actress. Tasha Smith, Erica Campbell's a famous gospel singer, and Areva Martin is a huge TV USA Wall Street bestseller author and on the TV all the time with commenting with the proper commentations when requested. So
I love
we've had a
it.
great time.
I was really itching to ask about the celebrity clientele, so I'm glad you just offered it up.
Since they volunteered, I
Of
can. Other than that, of
course.
course, we respect their privacy.
Of
But since they
course.
wrote it themselves,
That is
we can share.
amazing. I'm
Yeah.
really hoping you sell millions of copies.
Thank you.
Tell everyone how they can get a hold of you and where they can buy this book, and then we're going to open it up for some questions.
Okay. To find me at my website, and people tell me to say this, which is my name, www.doctor, which is DRGAIL Jackson.com, DRGAIL Jackson.com, and then at Dr. Gail Jackson on Instagram and Facebook
Mhm.
and anything. Phone, nobody uses a phone, huh?
No, nobody really uses a phone.
Okay,
But,
so that and my website, so I think you can purchase my book, I'm told, on my website.
oh,
So
good.
this is the pre-order copy. It'll be because we had to hold it, and we're waiting for one extra person who said, "Absolutely, I'm going to add something," and we're waiting for her, and then we'll close it and go, and that's Queen Latifah.
Oh,
So
my
yeah,
goodness
so if hers is
gracious.
not there, we just decided to close it without her, and we'll add it later. But she wants to do
So
something, but
this is
she's
your
busy.
advanced reader copy, and then it will be available on Amazon and all the other
All the
big
other sites that,
retailer
yeah,
sites.
yeah.
Dr. Gail, we love it.
Thank
Well,
you.
we would love to open it up to some questions from our audience. Yes, yes, yes.
So I was wondering if you did other types of like hormone treatment, like the Willy protocol or rhythmic dosing.
I couldn't hear you. I'm so sorry.
I was wondering if you did like the Willy protocol or the rhythmic dosing, like other kinds of
There's so
treatment.
many of those. I don't keep up. I don't keep up with those, so I don't do those. Our focus is just the hormone balance and using the pellets. We reviewed all those and just decided this is the one. And they're usually nurse practitioners or maybe allied health or whatever that do that. And we just kind of stayed within our realm of obstetrics and gynecology and focused on the pellets after reviewing everything was out there. And most of our ladies, if they try those tend to be often cumbersome with saliva and testing and things you have to do every day and whatever. And most of our ladies are busy. They're getting on planes. They're all over the place. You just want to come in every 4 months. They fly in and they're not interested in doing all that.
I
So we just
see.
sort of looked at our clientele and just tried to figure out what their needs were and then just focused on that.
Okay. Oh, we have another one. Go ahead.
Oh, doctors, absolutely fabulous conversations. Thank
Thank
you so
you.
much for that. Um, just a quick question about the treatments the partners, male partners come in for. A little bit more detail on that. How does that work? How long does it for? Is it 4 months too, or what is the difference?
The what?
The treatment for partners, for male partners that you mentioned about
Okay.
the testosterone, is it similar to the women? Or is it once every 4 months, or how does it work for theirs?
Yes, similar um protocol. We listen to the men, listen to their concerns, and we quantify their concerns. We get their baseline labs. The most important thing that's different with the men versus the women is we have to follow the prostate, the PSA,
Mm-hmm.
because testosterone can stimulate the prostate. So we have to follow that. So we just take only everybody's normal because these women beg that you have to help my husband. So if the PSA starts to creep or whatever, I have colleagues to send you over like, no, go over there, because I have one colleague who really does not deny any man testosterone, and he takes care of men with prostate cancer. So
Mm.
so that's it. And then we get the labs. So they get the pellets, and then testosterone only, and a lot more. For instance, women typically start with a 100 milligram pellet. Men start with about 800 to 1,000 milligrams, depending on their age. Then
Okay.
we add a testosterone blocker because testosterone can change to estrogen, and we don't want that because we only need one set of girlies in the bed,
Yeah.
right?
Yeah, we don't need
So
that.
then we get your labs in 1 month, see if your labs reached our desired levels, and most importantly, how you feel.
Mm.
And then we can give you more if necessary, or we can just keep going.
As long as the PSA stays low.
Right.
Okay.
Or
But if
stable.
the PSA goes up, they have the risk of developing prostate
Right.
cancer. So then you would refer them
Correct.
over. But they can continue testosterone with,
I don't ask.
a urologist. You're like, yep.
I stay with my ladies. Like,
Yes.
bye. PSA is going up. And it happens
Yeah.
sometimes, but especially men of color, the
Mm-hmm.
prostate cancer is so prevalent. You have to really make
Yes.
sure it doesn't creep. And one little tenth of a creep is significant.
Yeah,
So,
absolutely.
mhm.
Dr. Gail, we're out of time. I am
Ah,
sad because I could ask you questions all
ah.
day about this stuff. A lot of this is pretty new to me, especially the testosterone treatment for women. And
Mhm.
I really hope everybody who's watching has gotten something out of this. If they're experiencing difficulties with, menopause symptoms, you don't have to suffer. And I think that that was kind of the messaging way back in time, and we're now in the present, and you don't have to suffer. You can seek out help and treatment for that. So thankfully we have people like Dr. Gail Jackson, who is really a pioneer in this area. So thank you so much, Dr. Gail, for joining us.
You're so welcome. Thank you again for asking.
Yes,
I
absolutely.
love my evening afternoon with you. Evening with you,
Absolutely.
right?
Yes. And thank you all for joining the ANEW Body Insight podcast at City Club Los Angeles. We really look forward to our next exciting interview with Tiffany Elverton. We really hope you join us next time.
Oh,
Thank you,
yeah, you
everybody.
got to see Tiffany.
Thanks for tuning into the ANEW Body Insight podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Body Insight podcast tab. Follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.